Folks, 6.5 million women are at risk of losing maternity and newborn care if a Senate health care bill maintains a provision that will cut that coverage from Medicaid, according to an analysis by the March of Dimes. The bill would leave it up to states to decide whether maternity and newborn care constitutes essential health benefits as required by the Affordable Care Act. Making the care optional could negatively impact the health of pregnant women and babies, especially those born prematurely. There is a 10% chance for a baby born in the U.S. to be premature. Last year, the cost for a child born healthy was over $4,000. For a child born prematurely, the costs were enormous, more than $54,000. In fact, when you begin to examine all across this country, many women, also men, have been complaining about this Republican proposal because essentially what they're saying is if you choose to have a baby, that's not a pre-existing condition, which is a little hard considering you're carrying a baby up to 9 months. So how is that not a pre-existing condition? You would think these folks have actually had children. Joining us right now, Stacey Stewart, president of the March of Dimes Foundation. Stacey, what's interesting about this, and I've been looking at this whole back and forth. March of Dimes, American Cancer Society, American Diabetes Association, AARP. I mean, all of these organizations were saying this is a horrible bill. Right. And you would think more than a handful of Republican senators would say, we might want to listen to the folks who are in the business of chronic illness, but also caring for people every single day.
Right. And we tried on many occasions to entertain a conversation with many of the Republican senators, and we really were not able to have that conversation with many Republican senators over many, many weeks. And it was really... So
hold on, you're trying to tell me, so the March of Dimes could not get on the calendar of these senators for a meeting?
It's been very difficult, and we tried on many occasions. You know, this is a really serious conversation. I mean, what's at stake is the health of many pregnant women and babies. You know, and what's really disturbing is the fact that the health of pregnant women and babies has really been declining over the past couple of years. We just had some recent statistics come out to show that while premature birth had been declining for the past 7 years, over the past couple of years, we saw the health of pregnant women and babies actually declining over the past couple of years. So it was actually getting better for the past 7 years, and then the past couple of years getting worse. And so now, while the Congress is actually considering pulling health care away from pregnant women and babies and many millions of Americans, is now not the time to be thinking about doing that when health care is actually getting worse for many millions of Americans, especially low-income Americans, especially Americans of color, African Americans, and other Americans of color. And so the March of Dimes and other groups have been trying to entertain conversations with senators to talk about what's really at stake. We've not been able to have those conversations. We really hope that we can have a conversation to make sure that we retain the benefits that are so needed, especially things like maternity coverage, where women need to be able to have the kind of maternity coverage that is needed to have prenatal coverage that they need to make sure that they can have care before they get pregnant, certainly while they're pregnant, making sure that they can see doctors while they're pregnant, making sure that their babies have the care they need when their babies arrive, and certainly making sure that they're getting the care they need if their babies are born prematurely.
So this is confusing to me. So Senate Majority Leader Mitch McConnell had polio as a child.
Yeah.
This GQ article, Shelley, go to my iPad. This GQ article says Mitch McConnell wouldn't meet with the March of Dimes even though they treated his polio as a child. And then in the article, it says in here that he rejected meetings with American Lung Association, the American Heart Association, the American Diabetes Association, and the March of Dimes. The Senate Majority Leader. The folks, so he got care from a charity as a child, but then he wouldn't meet with the very same charity to get their thoughts about the Affordable Care Act.
A lot of people know that the Senate Majority Leader received care as a young person and he suffered from polio. The March of Dimes got started because of President Roosevelt, who also suffered from polio. You know, there are a lot of people in this country who have received care when they needed it, and because of government support, because of the support of charitable organizations like the March of Dimes, you know, when your child needs the support of care, you know, and when you are a parent and you want your child to get the support of medical care, and you want medical care to be there when you need it, you don't want to have to wonder whether or not any kind of care is going to be there, and you don't want to wonder whether or not you know, care is going to be taken away from you. And so this is what many millions of Americans are worried about, and this is what we want to make sure that Congress is thinking about when they think about whether or not many benefits will be taken away from many millions of Americans. We want to make sure they think about the care that needs to be there for many millions of Americans who rely on the care of Medicaid and who rely on the care of the medical system for all of us, and it needs to be there for all of us who rely on it day in and day out.
All right, Stacey Stewart, March of Dimes Foundation. We appreciate it. Thanks so much.
Thank you so much, Roland.
Let's go to our panel here. So, Brandon, your Senate Majority Leader, trying to pass this health care bill, can't even meet with the March of Dimes and all of these groups, American Lung Association, American Heart Association, American Diabetes Association. So what, are these partisan groups?
No, they're not. And I think, you know, I don't agree with you often, but on this point I do agree that, one, the Trump budget is not going to pass, it's dead on arrival, and also with the current health care bill, as you've seen today, it's down in flames. They cannot agree, and it's not anything doing with Democrats or Republicans. Republicans themselves cannot get behind the bill. So I definitely agree, and I support, you know, Stacey and the work that she's done. I was part of the March of Dimes efforts in Prince George's County 2014, and so we definitely need to continue pushing to reform the bill so that something passes. But as you know, Roland, we all agree the status quo cannot remain. We need to do something to the bill.
Obviously, Tiffany, status quo can't remain, but you cannot sit here and have a situation where Republicans refuse to even bring in Democrats. This president is absolutely lazy. He did nothing. All he's done is play golf. I can't recall him having a town hall meeting. I can't recall him doing what President Barack Obama did, sitting down in a publicly televised discussion with Republicans. I mean, he sent, what, 1 or 2 tweets out, maybe had a rally. I mean, he's literally sent more tweets out about the U.S. Women's Open at his golf course than he has on the issue of health care.
No, and I saw your Twitter timeline this morning, Roland, going off on him about he's lazy, and I agree with you 1,000%. The scary thing is this, is that you have a president whose biggest part of his campaign was, we're going to get rid of Obamacare. We are going to get rid of Affordable Care Act. We are going to shut it down, and we are going to have a brand new plan that's going to be perfect, and we're going to put it in place. And here we are on June, what's today, the 18th. And we're talking about a bill that failed last night. But the biggest important piece of this, Roland, is that last night at 10:17, Donald Trump, the president of America, tweeted Republicans should capitalize repeal failing Obamacare now and work on a new health care plan that will start from a clean slate. Dems will join in. You have, last night, Obama, all of the Dems and 2 independents who are completely against this bill, and now you have Republicans who are against this bill. You have a big baby, basically, who's in the White House right now, who is saying, I didn't get what I want, and I didn't work hard on it, but y'all are going to do it again. No, we're not. And he's going to find that, unlike his campaign, people are not going to do what he wants.
No, he's a well, this administration, and I say the Republican Party itself, is a constant contradiction. This is a party that constantly says we are pro-life, but everything they have done has spoken against that. They don't care about the poor, they don't care about women, and they don't care about children. And I think this bill and the bills that they've previously put forward is a reflection of that. And so Donald Trump is beyond lazy. He should have never been elected as president, and the fact that the Republican Party has not held his feet to the fire, I think just says a lot about them.
Well, they are, because they're not supporting the bill. I mean, you're saying they're not holding their feet to the fire, but there are some
talking
people,
about a handful of them.
A small minority, I agree. I want to make sure it's clear. You're saying that some are not. There are some, like myself and others, who are holding them accountable on things that need to change.
Are you holding him accountable, or are you talking about the bill specifically?
The bill, him, both the same.
That's not the same thing.
Him and the bill, both.
So has the Prince George's County Republican Party, did they officially release a statement opposing this bill?
Again, no, we're focused on Maryland and...
No.
I'm telling you right now.
One second. One second. Are you the Prince George's Republican Party?
Yes.
Which means that you represent the people in that county.
Exactly.
have you released a statement?
We have not. We have focused on the issues going on in Maryland.
No, hold up. This is the issue. No, no, I'm sorry. This bill,
I'm telling you no.
No, Brandon, does this bill not affect people in Maryland?
I hear you.
No, does this bill affect people in Maryland? One second.
Yeah.
Does this bill affect people in Maryland?
It does.
Does this bill affect people in Prince George's County?
It does.
And so, when you say, I've opposed, so has the Prince George's County Republican Party released a statement specifically opposing this Senate health care bill?
And no, let me help you explain it out, Roland. There are different levels to how the party is structured and organized. Our county party focuses on things going on in our county and our state.
Yes, a bill that affects people in your county.
No, but I'm talking about the county legislators. We focus on the county legislators. That's the way it's organized.
So, okay, so what you're saying is
you should look to the RNC.
Y'all don't care about any other issues outside of the county officials in your county.
No, there are those who are supposed to care about those issues. I'm not part of that body who's supposed to work on those issues. Our focus is on local legislators, local politicians, local issues. No, it's not.
Okay,
I'm not letting you know.
No,
it's on local. Actually, I'm telling you what it is.
Yeah,
it's local issues, local. We have not issued a statement on that. But I'm telling you right here, right now, parts of it I do not agree with.
The healthcare piece is local. So you,
no, it's put by federal legislators.
So you as an individual don't agree, but the county has taken no position.
Because we're focusing on local politicians. I'm talking about some of those issues a little later. We'll talk about it. Yeah, some of the things we're talking about on the local level.
Okay, but y'all supposedly representing the people of Prince George's County.
And the local elected officials. The RNC does national, and they're the ones who I agree have not been as vocal as I would like them to be on the issue. Okay. That's how it's structured, though.
Okay.
Yeah, that's how it's structured.
This is called TV side-eye.
Weekdays on TV One.
I will never lie to you.
Oh, my God.
Roland Martin.
He doesn't want to talk to us. He wants to ignore us.
Uncensored.
Hell no.
That ain't gonna cut it, boo.
Unapologetic.
No, that is fundamentally false. You are wrong.
Unfiltered.
He wants an America where we all look alike. He ain't talking about black people.
Unrelenting.
You better go work out, because you got a fight on your hands.
NewsOne Now with Roland Martin. Weekdays at 7 a.m. on TV One.